Hi everybody, this is a video about Methylene Blue. Just before jumping into the video, if you don't mind taking a quick second to please like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I say should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So with that out of the way, someone posted a question on one of my other videos, also about methylene blue, as it turns out. And the questions are: how much methylene blue do you give in an IV at your clinic? How often can they be given? What are the main differences your patients see when they receive one? And so interesting. So I agree, methylene blue, very interesting topic. If you're not familiar with what methylene blue is, there's actually a growing number of podcast episodes and YouTube videos and things like that about methylene blue that I've seen anyways. I'm sure the algorithms are all kind of tweaked towards my things that I click on and whatnot, of course, as they are for all of us, but seems to be that there's more of talk about methylene blue, and I think it's great. I think it's a really great therapy. It's a very, very strong antioxidant, so it can be a really useful therapy for folks. So thank you for the questions. Again, nothing I'm saying should be construed as medical advice, and normally I don't talk about dosages in my videos because it could be construed as medical advice, even when I say it's not medical advice. But asking about how much we give in IV form, of course, can't really get IV therapies unless you're working with a clinician, so I don't mind talking about dosages in this one context. So in our clinic, we usually, almost always, virtually always, start patients at a lower dose and gradually build up to make sure that they're tolerating it well. So the maximum dose that we would typically build up to, depending on the patient's body weight and all of that, would be 50 milligrams of intravenous methylene blue. That methylene blue is sourced from a compounding pharmacy, so it's as free of impurities as humanly possible. And I say as free of impurities as humanly possible, as you'd hope that would be the case. But to my understanding, some non-pharmaceutical grade methylene blue can be contaminated with different heavy metals and things like that. And so we really want to avoid those as much as humanly possible, especially when it's going right into the bloodstream. In terms of the frequency of the IVs, we've only done them with weekly frequency. I've never done them more often than that. I'm not 100% sure if there'd be any additional benefit to doing them more often than once a week. I find that I feel that they're a very, very strong antioxidant boost for the body. I think we need to give the body time to deal with those, to incorporate the effects of those antioxidants. And also, we do want to be careful to not inundate the body with too much antioxidant therapy. We generally put antioxidants on a bit of a pedestal, and on the one hand, rightly so, because they are very, very important. But at the same time, it is important to remember that we want to have a balance between antioxidants and pro-oxidants. If we didn't have pro-oxidants, we would not have life. To make energy in our cells, in our little wonderful mitochondria, we need to, they have oxidative reactions that are involved in making energy. So without that, we would not function. So we don't want to overdo it with the antioxidants. But usually once a week. And what are the main differences my patients see when they receive IV methylene blue? The most common impacts that we see are improved energy and improved mental clarity. To be perfectly frank, patients who are quite unwell, they're having a lot of symptoms and whatnot, like they're suffering from chronic mold toxicity, Lyme disease, whatever it happens to be, those are the folks who would typically find more benefit with, say, energy level and brain fog reduction, things like that. But there's another subset of patients that work with methylene blue, and that's more in the biohacking community, where it's like, I'm feeling good and I just want to top up my antioxidants that much more. I want to just see if I can feel that much mentally sharper and whatnot. And so we do see benefits in that realm for those patients as well. Of course, a person who's already feeling just about 100% well and they just want to be at the top of their game, maybe they'd only see like a 10 to 15% benefit because they're already feeling really good, and you can only get so close to superhuman status. Whereas someone who's feeling quite unwell, they might feel quite a lot better than that. With bringing the treatments into the mix. So typically energy levels and mental clarity enhancement are the main things that we see. To be perfectly frank, I've had some patients who have like neuropathy and symptoms like that, and have seen some improvement there as well, but that's not usually the main treatment that we work with for neuropathy, but it can be a fringe benefit because methylene blue, quite frankly, is a bit of a multitasker. It's good for so many elements of our physiology. So I kind of put that on the list too, but it's just usually not the main thing that we're trying to target with the methylene blue. So thank you for the questions. I hope this was useful information. If anybody has any further questions about methylene blue or any other topic, please don't hesitate to post in the comment section below. If you yourself have tried methylene blue, say intravenously, feel free to post anything about Methylene Blue, really, but specifically if you've tried intravenous Methylene Blue and you found it's been helpful for you, was not helpful for you, you had side effects, whatever you want to share with us, if you feel comfortable sharing, please feel free to post that in the comment section. I'd be curious to know what your experience is like. And otherwise, I will leave it there for now.